Heart disease is one of the leading causes of death in the Philippines and worldwide. It has cost many people their chance of a better quality of life, their hard-earned money, and worse, the life of a loved one. One of the most common heart diseases is the aortic valve stenosis, the narrowing of the aortic valve that reduces and blocks the blood flow inside the heart. If left untreated, this can lead to more serious heart problems, such as heart failure, stroke. It can even result in death. Experiencing symptoms such as swelling of legs and shortness of breath experienced by people living with aortic valve stenosis are not new to patients like Mr. Harold Phillips, whose heart function slowly deteriorated because of the disease. His experience is shared by other patients who also face the grueling effects of an ailing heart.
I used to drive and I'd attend socials. And even that September 1st, I was dancing a lot. But September 3, I felt this early morning, that this heaviness in my chest.
For 61-year-old Zenaida Sandoval, however, the shortness of breath and dizziness came about suddenly while she was on vacation last year.
Naalala ko, nasabi sa akin ni Dr. Posas, what happened in Boracay was a frustrated death. So don't wait for the sudden death to come.
So it is deadly. It typically manifests as either chest pains, they can manifest with passing out or loss of consciousness, and or can manifest as progressively severe shortness of breath. Towards the latter part of the manifestations, it can manifest with heart failure.
Fortunately, there's a treatment that patients can undergo, the transcatheter aortic valve replacement or TAVR. Since the first successful treatment in France in 2002, TAVR has been addressing the needs of patients with valvular heart disease across the globe. And since it was introduced in the Philippines in February 2012, the TAVR has given patients a less invasive option to replace deceased aortic valves through revolutionary catheter delivery techniques and 3D imaging system. Now approved by the U.S. Food and Drug Administration for low-risk patients,
The way in which we do the transcatheter aortic valve replacement, whether it can be done fully percutaneous, meaning no general anesthesia, no cuts, we do have devices that we use that we can close the holes that we create. All outcomes are assessed clinically, all outcomes are recorded, and we follow those patients over long periods of time. The point is really to be able to define the extent to which these therapies that we have introduced are benefiting patients.
randomized trials have shown TAVR as equally effective as open surgery and recommended across ages, not solely for the elderly.
We have now done about 165 transcatheter aortic valve replacements with outcomes that match anything that you can read on the literature being reported from the best institutions in the world. And we are proud.
Comfortable ka. And you feel okay. Unlike before, that was back in 2010. I had to undergo several weeks, even months, to overcome that feeling. I had a very good care here. They were very, very attentive and very caring. And they let me feel that they're after my good health, that I'll recover.
I'm an engineer by training, actually. So when I looked at their efficiency in diagnosis, it was very precise compared to Middle Eastern or even UK hospitals.
A set of doctors gave me the option. And I chose this because this was for me the easiest way to recover, which was true. I went through my procedure, which lasted very short. It was a very short procedure, By noontime, I was in the CCU, and my recuperation is very fast.
After the 2 hours operation, when I was transferred sa CCU, siguro mga mabilis kasi yung 10 p.m. nakalakad na ako eh. Then the following day, yung second day ko, when Dr. Posas visited me, wala, smiling na ako. Parang nothing happens. No pain pa rin.
Still, Dr. Posas has greater things in mind. Along with other specialists, he is training teams in Cebu and Davao to properly conduct the TAVR procedures.
We aim to create environments here through which we can access the best technologies and the newest technologies in the world and be able to introduce them into our medical delivery services as they develop.
For patients who have undergone TAVR treatments, however, there's nothing more gratifying than being able to go back to the lives they once led.
After a month, I can go and resume again my activities. You know, going to church, go around town, go to social activities, attend meetings, go to the supermarket, and enjoy and walk and shop and eat.
Symptomatic aortic valve stenosis increases mortality and impairs one's normal function. It can be deadly when left untreated, with a worse survival rate than most common cancers. For these patients, this less invasive treatment has delivered on its promise of a safer and faster recovery period, a fitting treatment for patients like them, who through TAVR have already regained what they once lost.